Welcome to our channel. Today, we're diving into the bizarre world of historical medical treatments. Get ready to be amazed, shocked, and maybe even a little disgusted as we uncover the bizarre world of historical medical treatments. Imagine a time when a headache or a common cold could lead to a rather gruesome treatment: bloodletting. This practice, rooted in the ancient theory of balancing bodily humours, was a mainstay of medicine for over 2 millennia. The four humours, blood, phlegm, yellow bile, and black bile, were believed to dictate a person's health and temperament. An imbalance, they thought, was the root of all illness. Bloodletting involved the removal of often significant amounts of blood, either through venesection, cutting veins, or by the application of leeches. Patients, ranging from the common folk to royalty, underwent this procedure for a vast array of ailments. Weakening an already ill patient, this practice undoubtedly contributed to countless deaths throughout history. Prepare yourself, because we're about to explore one of the most visually shocking medical procedures in history: trepanation. This practice, involving the drilling of holes into the skull, dates back thousands of years and is found across various cultures worldwide. Imagine, if you will, the tools of the trade: sharp obsidian blades, hand-cranked drills, even rudimentary saws. These were employed to create openings in the skull, often with the patient fully conscious. Some believed it could release evil spirits thought to cause madness or epilepsy. Astonishingly, there's evidence that individuals survived this procedure, as evidenced by skulls showing signs of healing. Can you imagine the pain and the risk of infection? It's a testament to human resilience. We're delving into the world of pharmaceuticals, and our next subject is a substance both fascinating and terrifying: mercury. This heavy metal, known for its toxicity, was once a common treatment for a variety of ailments, most notably syphilis. Desperate for a cure, physicians turned to mercury, administering it in various forms. One method involved applying a mercury-based ointment to the skin, hoping it would be absorbed into the body and combat the disease. Another, even more alarming, involved ingesting mercury or inhaling its vapors. While mercury could, in some cases, suppress the symptoms of syphilis, it also came with a host of horrific side effects: tooth loss, neurological damage, organ failure. Mercury poisoning was a cruel and often fatal consequence of this misguided treatment. Our journey into the bizarre takes a rather macabre turn as we explore the use of mummy powder in medicine. Yes, you heard that right. Ground-up mummies were once considered a valuable ingredient in various remedies. The preservation of the body after death led some to believe that mummies possessed powerful, life-giving properties. This belief, coupled with a dash of superstition, made its way to Europe in the Middle Ages. Mummy powder, often imported from Egypt at great expense, became a sought-after commodity in apothecaries across the continent. From headaches to epilepsy, impotence to plague, mummy powder was touted as a cure-all. In fact, consuming ground-up mummies likely did more harm than good, potentially exposing individuals to bacteria and other harmful substances. Hold your noses, because we're about to delve into the world of animal dung ointments. Yes, you read that correctly. In the quest to heal the human body, our ancestors experimented with a truly diverse range of ingredients, and animal excrement was no exception. Various cultures, from ancient Egypt to ancient Greece, incorporated animal excrement into their medical practices. One of the most common applications was in the form of poultices and ointments. Animal dung, often mixed with herbs or other ingredients, was applied topically to wounds, sores, and other skin ailments. Some believe that certain components of animal dung might possess antiseptic or antibacterial properties. While the effectiveness of animal dung ointments is questionable at best, it's a fascinating example of how desperate times often led to creative, albeit rather smelly, medical interventions. Brace yourselves, because our next chapter delves into the truly macabre cannibalistic cures. While it might sound like something out of a horror movie, the consumption of human body parts for medicinal purposes was a surprisingly widespread practice throughout history. This gruesome practice stemmed from the belief that the human body held potent life force or healing essence. By consuming certain parts, such as the heart, liver, or even blood, individuals believed they could absorb the vitality of the deceased. One of the most well-known examples is the practice of corpse medicine in 16th and 17th century Europe. Human fat, often obtained from executed criminals, was highly prized and used to treat a variety of ailments, from epilepsy to gout. While the idea of consuming human remains is abhorrent to us today, it's essential to remember that these practices were often driven by desperation and a lack of understanding about the human body. Hold on to your hats, because we're about to explore one of the most bizarre and, frankly, dangerous medical practices in history: tobacco smoke enemas. Yes, you read that right. Blowing smoke up someone's rectum was once considered a legitimate medical procedure. This practice emerged in the 18th century, during a time when tobacco was gaining popularity for its supposed medicinal properties. Physicians believed that tobacco smoke, when administered rectally, could stimulate the body and even revive drowning victims. The logic, if you can call it that, was based on the idea that tobacco smoke acted as a stimulant and could kickstart the respiratory system. Aside from the obvious discomfort and indignity, tobacco smoke enemas could cause severe abdominal cramping, vomiting, and even nicotine poisoning. While the practice of tobacco smoke enemas might seem ludicrous today, it's a stark reminder that even the most outlandish ideas can gain traction when medical knowledge is limited and desperation runs high. Arsenic, a poisonous elixir. Our journey into the annals of bizarre medical treatments continues with a substance both fascinating and deadly: arsenic. This potent poison, often associated with murder mysteries, was once a surprisingly common ingredient in various medicines. The use of arsenic in medicine dates back centuries, with mentions of its therapeutic properties found in ancient Chinese and Greek texts. One of the most common uses of arsenic was in the treatment of syphilis. Before the advent of penicillin, arsenic-based drugs, such as Salvarsan, were hailed as a breakthrough in combating this devastating disease. However, the line between a therapeutic dose and a lethal one was perilously thin. Lobotomy, severing the self. Our exploration of controversial medical treatments takes us to the 20th century, where we encounter a procedure as fascinating as it is unsettling: the lobotomy. This neurosurgical operation, which involved severing connections in the prefrontal cortex, was once hailed as a revolutionary treatment for mental illness. Developed in the 1930s, lobotomy quickly gained popularity as a seemingly effective treatment for a wide range of psychiatric disorders, from schizophrenia to severe depression. The rationale behind lobotomy was based on the idea that by disrupting the neural pathways in the prefrontal cortex, the emotional distress associated with mental illness could be alleviated. While some patients did experience a reduction in their symptoms, many others were left with severe and irreversible side effects. As our understanding of the brain and mental illness evolved, the use of lobotomy declined rapidly. Urine therapy, drinking the golden elixir. Our journey through the annals of strange medicine concludes with a practice that might make you wrinkle your nose: urine therapy. Yes, you read that right. Drinking your own urine was once considered a viable medical treatment for a surprising range of ailments. The use of urine in medicine, known as urotherapy, has ancient roots, with mentions of its therapeutic properties found in texts from ancient Rome, Egypt, and India. Proponents of this practice believed that urine possessed unique healing properties. Urine, being a byproduct of filtration in the kidneys, contains a complex mixture of water, salts, urea, and other metabolic waste products. Some of the purported benefits of urine therapy included boosting the immune system, promoting wound healing, and even treating cancer. However, there's no scientific evidence to support these claims, and in fact, drinking urine can actually be harmful. Thanks for watching. From bloodletting to tobacco smoke enemas, we've journeyed through some of the most bizarre and often cringe-worthy medical treatments in history. It's a stark reminder of how far medical science has come and the importance of critical thinking when it comes to our health. Thanks for watching. If you enjoyed this video, don't forget to like, comment,